Hello, everyone, and welcome back to Entheon's channel. We're sitting here once again with Tim. We just wanted to have an interesting discussion today around psychedelic use and trait openness and the potential psychedelics for treating addiction. Tim, how you doing today?
I'm doing great. How are you?
Not doing bad at all. Welcome to Friday. It's always a good day, right?
It's always nice to arrive at Friday.
True, true. So let's jump in. First off, when I'm talking about trait openness, I'm talking about openness to experience, which is kind of defined as one of the big five personality traits. Going along with that would be conscientiousness, extroversion, agreeableness, neuroticism. So openness to experience is it's kind of like on a scale. It goes from like inventive, curious versus people who are more like cautious and consistent, maybe not quite as open. So psychedelic use has been shown to increase trait openness amongst people seemingly permanently from several studies that we've seen. And also psychedelics have been used in studies. Again, it's nothing, we're not talking fact here, we're talking studies, hypotheses, theories, but to potentially treat addiction. So Tim, I wanted to propose to you, do you think there's some sort of link between these two things?
Yeah, absolutely. It's these things are inherently difficult to talk about because a lot of it does resonate or exist within the brain. And so these measures are interesting in that, sometimes the translational value is difficult to certainly ascribe to specific pathologies like addiction. But, in a purely, like, this is just my thought process around it, in a purely sort of trying to link that idea, I do think that, if we look at addiction as a habituation of not only behaviors, but a habituation based on a specific type of belief set, often, as is the case, and so I observed with my brother and other, substance use disorder sufferers that I've witnessed, is that often there is a sort of rigidity and a closeness to new ideas. And that's particularly, inhibiting when someone has cemented beliefs around their prospects for life or their optimism or their self-worth, or their sense of hope that things will get better. That's a pretty typical thread among those that suffer from not just substance use disorder, but also depression and other types of things, that there is a sense that things are bad, I'm not worth it, and things won't get better. And operating from that belief set, that is a highly distressing belief set to, operate on. And so obviously, when it comes to people that suffer from substance use disorder, there will be almost magnetic pull towards something that even momentarily gives them a sense of relief of that. So with regard to those that, do ruminate on these issues of self-worth or importance or sense of connectedness, I do think, trait openness is very likely highly correlated to, their, what drives their substance use disorder.
Yeah, I think it's interesting to see the psychedelics cause both trait openness and help with treatment of addiction from the studies that we've seen. So it's hard to tell if there is a true connection between the two, but you're right. It does seem to make sense that someone who is not quite open to new ideas could be stuck in vicious cycles of their own brain's pathology of habit forming, right? So I think as we see more studies come out, we'll find out why it is and how it is psychedelics really play a role in treating addiction, right? Whether it's strictly something chemical or something more psychological, right? Something to do with the experience of it. It'll be interesting to see, and I'll be happy to see more studies on it.
Absolutely. Yeah, we're also we're in that really interesting opportune transition phase from speaking about psychedelics purely from the experiential, the mystical, and the hard to define within data. And so, that is sort of the interesting area that we're trying to investigate to get a more empirical basis of understanding around. And so, we do believe that, utilizing some of the technologies that we're exploring, from the neurophysiological, exploring how actual brain activity changes under the effects of psychedelics, we're hoping to see what areas of firing and upregulation, downregulation are responsible for the types of neurophysiological changes that do trigger something like trait openness. And coming from the perspective of being able to see what a person's baseline neurophysiology looks like before any treatment takes place, then also being able to map what the intra experience looks like, and then following on, the presumption is that there will be a sort of meaningful structural change that denotes what a person looked like before they felt better. And then, upon the successful treatment, which we're really all betting that psychedelics are effective in doing, seeing what the actual functional structural changes are, so that maybe we can parse out what brain areas are effective or affected, and regulate things like trait openness. So a ton of interesting stuff that I think has implications beyond just the psychedelic sciences, but also more broadly within mental health. And so we're very happy to be positioning ourselves in terms of or within that stream of investigation.
Wonderful. Well, Tim, it's been a pleasure talking to you. If anyone has any questions, don't be afraid to shoot them over to us. We'd be happy to answer them. If you have any other topics that you think would relate to Entheon and the work they're doing, don't be afraid to shoot them over. We'll be happy to answer those as well. Have a wonderful day, Tim.
Absolutely.